Welcome to Healthy Conversations. I'm Susan Claiborne, joined with Caroline Canestrari, and today we're joined with Dr. Fry from Radiology of Huntsville and Leslie Wallace, our Director of Imaging Services. They're here to share an exciting advancement in breast cancer screening, the Invenia Automated Breast Ultrasound, now available at Athens-Limestone Hospital, thanks to support from our foundation. Dr. Fry and Leslie, welcome. Thank you both for being here today and joining us. I know getting out of the hospital is sometimes hard to do. So, Dr. Fry, as we kind of get started, just tell us a little bit about your background and the work that you do with Radiology of Huntsville in the hospital.
I'm Dr. Paul Fry. I am a full partner with Radiology of Huntsville, and we cover most of the hospitals in the Huntsville hospital system, as well as some other imaging centers in Huntsville surrounding area. We have the contract for Athens-Limestone, of which I'm the medical director. A little bit of background, I grew up in Knoxville, so I just kind of came downriver to Alabama, went to medical school in Memphis, did my radiology training in Charleston, South Carolina. I've been here since '94 when Dr. Cannon recruited me, and just love being here, love to be here.
Great. Well, we're glad to have you. I love Knoxville, such a beautiful area. So, Leslie, kind of as the Director of Imaging Service, what is your role and kind of about bringing the ABUS to Athens-Limestone Hospital?
Well, I feel like my role is to stay current with evolving technologies. And then when I see something that I think would benefit Athens-Limestone Hospital or the community, then I start conversations with Dr. Fry and we look for ways to get that implemented.
So that kind of rolls into what we're talking about today. So kind of how did each of you kind of become interested, I guess, in breast imaging and kind of the technology and kind of the innovations? Like, how did we get to the point of bringing the ABUS to the hospital?
Well, for me, on a personal note, my mother had breast cancer. She was 38 and she's 89 now. So it's actually one of the things that got me into radiology in the first place. And mammography of breast imaging is a large part of radiology, of imaging the body. Of course, it affects 50% of our population, women. And with the cancer rate of 1 in 8, it's one of the few areas of radiology and medicine in general that's had such a meaningful impact on women's lives.
For me, I have worked hands-on in breast imaging for many years. I've had the opportunity to work with these women with dense breasts, and I can see the frustration that they have trying to get supplemental imaging to go with their mammogram. The ABUS, while it is still an ultrasound, it does have the ability or advantage to be replicated year after year for comparison.
Wonderful. Well, you brought up the ABUS. So, Dr. Fry, I wanted to ask you, how does the new ABUS technology differ from a traditional mammogram or a traditional ultrasound? How do they differ?
Well, mammogram is ionizing radiation. It's X-ray, and you're looking at the breasts on a yearly basis, beginning at age 40, looking for breast cancer. And back up first is that 1 in 8 women will get breast cancer in the span of their lifetime. And really, there's not really much you can do about getting breast cancer other than you want to discover it and find it as early as possible. Just in the last 20 years, I mean, the mortality rate has fallen by 50% just in that little 20-year period. So the earlier we could find something, the better. There are some limits to mammography, even though it's a very good test for women with dense breasts. We're looking for changes over time. So with the dense breasts, it's harder and takes longer to see that change. So that's where ultrasound has come in. Up to 50% of the women have dense breasts. And so by using another modality, ultrasound, we can see the breast in a different modality using sonar, basically ultrasound, to find these nodules. And so the difference between the automatic breast ultrasound and just a handheld, one, it takes away the idiosyncrasies and the differences in personality, because the technologists will look through the breast. And the automatic breast ultrasound uses a single transducer, covers the entire breast. And then you can, with the wonder of computers, you can reproduce those, look at them in different planes, and look through the breast to find those early changes to look for breast cancer.
I got you. So why is the ABUS so important for women with dense breast tissue?
Well, like I said, 50% of women will have dense breasts. And so it's recommended now by the American College of Radiology that you supplement the mammography with ultrasound. And you could do it by the handheld, which is the traditional way. But the automatic breast ultrasound is kind of the next generation where you can image all the women the exact same way. You can go, it's reproducible. You can keep it. You know you're not missing any breast tissue. And so that's the next step, is to look for those lesions very tiny that we wouldn't see in dense breast tissue. We see it better with ultrasound.
Kind of like Leslie was talking about, the comparison, doing it year after year. I guess if you're doing it handheld, you may not necessarily be looking at the exact same thing year after year. Whereas with this technology, it's kind of the same thing because you're
Correct. And you can go back if you're following, say, a cyst or something that you know is just a benign lesion like a fibroadenoma. It's going to look the same way the following year using this automatic breast ultrasound.
That's interesting.
That is. So, so studies obviously show that the ABUS improves the cancer detection by 35% when added to mammography. And I know you kind of talked about that being so significant because of the 1 in 8, and I happen to be 1 in 8, almost 4 years removed. So that's wonderful. And mine was caught with mammogram. I did not have the dense breast, but I am just so passionate about understanding this for those women, because I do have those friends who talk about how difficult keeping up with their breast health is, because they're either, I don't know, they have, lumpy breast to begin with, or they have the dense breast, and so they don't get kind of the same scan as like I got, when I got mine. So are there risks or downsides to the ABUS, to the technology, radiation, comfort, cost, insurance? Can you speak to kind of the pros and cons of those?
Well, it's not ionizing radiation, so it's very safe. You cannot harm the woman. It's just sound waves. There's an extra expense, and insurance, I'm not really sure exactly which insurance covers and don't, but that's about the only concern. And for women with dense breasts, almost all the insurance covers it.
Okay, that's great. So how does it improve patient experience as far as, for women? We know the whole going to a mammogram and the discomfort and things like that. So, we kind of want to know what we're walking into. So,
Leslie, you may be better off on telling the technology part.
Well, for the ABUS, there is a little bit of pressure, but not typically as much as a mammogram. Maybe not a little bit more than a typical handheld ultrasound, but well worth the experience.
it's a different experience in the fact that you're kind of laying down like you do in an ultrasound versus the standing up and the.
I can kind of speak to this because I was able, y'all had to have some volunteers to, get everything going technology-wise and to get the machine synced. So I actually was honored and blown away at the technology, and it was painless. There was barely any pressure. It was not bad at all, and it was just amazing to have that technology here in Athens. So I was really excited about that.
Yeah, I forgot you and a couple of others kind of got to assist kind of with that setup, kind of as y'all tested, calibrated, all those kind of things to be able to experience that.
And taught the techs how to use the machines.
Yes, it's kind of, it serves as a training for the techs as well. So how can women know if they have dense breast tissue, if they've never even had a mammogram? Is there a way to tell if you have dense breast tissue?
Well, the radiologist, when he reads the study out, will give what is the classification of the breast density. It's either a fatty breast or scattered fibroglandular tissue, and that's the one that you're looking for. The change in nodules is very easy to see. When you've got heterogeneously dense, we'll dictate that out, or extremely dense. That's where the need and the recommendation is to do supplemental imaging by ultrasound.
That was my next question, is when do you recommend that next step? So is the ABUS only for women with a family history of breast cancer, or can average risk women benefit from this technology as well?
Well, actually, it's really for the average risk. So all women with dense breasts are recommended to have the supplemental imaging. Now, if they have a BRCA gene or if they have a strong family history of breast cancer, the recommendation is actually MRI, which is kind of the next step. Obviously, it has its own cost and problems. But if you have the gene, you have a family history, or sometimes just following up a history, they'll recommend the MRI. Now that sometimes there's a little bit of controversy in the scientific community about should you have the ultrasound also? Should it be a screening ultrasound, or would it be a diagnostic ultrasound? It is important to know that this is a screening test. If there's something that we see, we'll have the woman come back and we actually, with the handheld, look at that, see if we feel it, correlate it with the mammogram also.
When you focus in on that one spot. Okay. Yeah. Well, I mean, I know women who delay in even getting their mammograms because they know every time they go, they're going to have something that needs to be looked at more, and they get, I don't know, stressed and worried. And so they kind of delay going for that reason. So I'm glad we have something like this that can give them that peace of mind, I guess, to be able to follow up with that. So, Leslie, can you walk us through kind of what that process is for a woman who has dense breasts and can benefit for this? Like, does she need a referral? How does that process work?
Well, all insurances are different, obviously, but typically a referral is needed. An ABUS is a physician-ordered imaging exam that can be from their primary care physician, OBGYN, a breast specialist. Also, there are those that come in for their screening mammograms, and the radiologist dictates the dense tissue in their breast, and then they sometimes recommend that as well in their report, that is something that would be beneficial to them.
Okay. And you kind of already answered the question, like an insurance. Sometimes it can be covered and sometimes it may not, or you may have deductibles, and that's so individual for every person. There's no way for us to kind of answer that question. But it is new, so I guess we are trying to educate and inform the community that we have it, including physicians, so they know that if they have patients that could benefit from this, that they can do a referral to the hospital for that. So that's great. Well, I know this is a big deal not only for the hospital to have, but for also the community to kind of recognize kind of how we have this piece of technology. So I'm going to kind of let Caroline talk about the foundation's role in that piece.
Yes, so I'm the director of the hospital foundation, and we were so blessed to be able to raise the money for this vital piece of equipment for our community. So thanks to the foundation and community donors and sponsors and businesses and individuals for donating to our Pink Elephant Fund and to be able to purchase this kind of technology. So what does it mean for patients to have this locally instead of having to travel maybe somewhere, Nashville or Birmingham or even to Huntsville to have that here? What does that mean for patients?
Well, I think the goal, obviously, is every woman in the country, for that matter, but Limestone County specifically, to receive a mammogram when they have to have a mammogram. And that includes all socioeconomic groups. And I think that's where the foundation has been very good with Pink Elephant Fund sponsoring scholarships for women that don't have the means or don't even have the insurance coverage to get the mammogram. And this is just the other step that all the women could not only get the mammogram, but if needed, get the extra ultrasound, which would obviously look for breast cancer sooner.
Yeah. Well, and I'll just add that we have recently kind of completed the month of October and the Pink Elephant Luncheon and kind of raising funds for that. But the work never stops. So I want, people to understand that, yes, while we have done that and October has ended, you can give to the Pink Elephant Fund at any time throughout the year. And those scholarships can be reached out for anytime throughout the year. So that is a great program to have. So let me just, in closing, because I think we have kind of covered the ABUS, and obviously there is additional information on the internet if people want to look up the ABUS and see videos of how it works or how the technology, the scans look. Those kind of things are out there on the internet. But if you were to share one key message with women in our community about breast screening or the ABUS, what would that be?
The main message would be that to not avoid getting your annual screening, whether it be ABUS and mammogram or just your mammogram. I think that's the key message. But we have both. We have new technology for mammogram and ABUS here in Athens. And we have our ABUS system over at Limestone Medical Village, and they're open Monday through Friday. So I think it's really important for people not to let that annual screening pass.
Well, and I'll echo that. As someone whose breast cancer was caught with their annual mammogram, I definitely agree and encourage everyone to not miss that mammogram. Dr. Fry and Leslie, thank you for joining us and helping our community understand this new ABUS technology. To our listeners, about 50% of women have dense breast tissue, which can make cancers harder to detect with mammography alone. Now this advanced screening is available right here at home. Talk with your healthcare provider to see if ABUS is right for you. Thanks for joining us. Together, we're building a healthier community, one conversation at a time.